Okay. Okay, so we're recording. This is Adam Zarenko. I'm the Executive Director of the Albany County Land Bank, and we are convening the Human Resources Committee meeting, and we're convening it remotely via teleconference because of the COVID-19. The Governor's Executive Order 202.1 allows suspends Article 7 of the Public Authority Law, Public Meetings Law, and permits public bodies to meet virtually for now. This will be recorded and transcribed in accordance with the Governor's Executive Order from March 7th. So I will introduce the folks that I believe are on the call from the from the HR committee. So we have Charles Toohey, we have Pastor David Trainum, we have Jeff Collette, I believe Todd may be on the line, Todd Curley, and from the staff side we have Amanda Wyckoff, our Director of Operations. And on the agenda I sent the committee members, there's really only one item where we need to, we're seeking to update our health, vision, and dental benefits. The last time the corporation looked at these holistically was almost 4 years ago. It's when I came on board. It's been going on 4 years now. And we offered our first benefits package to employees. And our current window for changing that and open enrollment is quickly approaching. So timing's not perfect given the circumstances in the world right now in terms of meeting on this, but we wanted to do it because it's in the interest of our employees and our company. So what we did was I sent around some materials, but I'm sure different folks have different things going on the committee, so I'll just highlight kind of the situation right now, the benefits that we offer. So we offer employees.
Can I interrupt for a second?
Yep. Sure.
First on the agenda was supposed to be the review of the minutes from our November 4th meeting. Did we want to go in order, or are we where we are purposely?
No, we can go in order. Yep, that's true. I overlooked that. Everyone received the minutes?
Just so we're right on point.
Good point, Pastor Tranum. Has everyone received the minutes from the last time we convened the Human Resources Committee, which was largely around finalizing the updates to the employee handbook and personnel policies? And that was in November.
Correct.
Any questions about the minutes or changes or modifications?
None. I accept them as they're written.
Okay. All those in favor?
Aye.
Aye.
All right.
Okay, very good.
Thank you, Pastor Train.
Thank you, sir.
And so back to just the landscape of our current benefits, employee benefits, we offer a healthcare plan. It's a MVP, EPO, high deductible healthcare plan. It's the Silver 8. If you have the medical plan analysis spreadsheet we sent you, it's the first column on that plan. And the way that works is employees are eligible, full-time employees are eligible for the healthcare plan. The company at the time, 4 years ago, decided to contribute to help offset the high deductible part of the healthcare plan by employees can establish HSAs or health savings accounts, and there is a pre-tax deduction contribution from employees, and also the company contributes to the HSA to help offset the costs. And if you don't opt in under the current model to take a healthcare plan, participate, there's still a contribution to the HSA from the company. We also offer we also offer vision and dental. So our dental is Delta Dental, and so I included the summary sheet for that. We have the Essential Plan, which is what we're recommending to continue with. And on the vision benefit side, the vision benefits included a $1,000 per year contribution by the company to the HSA, and then that funding is eligible to be applied towards vision. But the way HSAs work is you can use it for certified or approved uses, medical uses is a whole list of things that are published. But if you don't use it, it's essentially the employee's money to use for future health care. It rolls year after year, it rolls over. So that's our current benefit. And so as we grow, back then we had 3 people, now we have many more. So what we wanted to do is we wanted to look holistically at our healthcare package, make sure that as we grow, we're providing benefits that are competitive and comparable with other entities like ours, but also realizing that we have an obligation to keep our costs reasonable, and we tried to strike the balance with still providing, a similar level of benefits to employees. So we work with our HR consultant and Gallagher Companies, which is someone we just recently brought in that helped us kind of shop around because our renewal window's up, the different plans that will be available to us that met those goals that I just referenced earlier. So I tried to summarize it over email, but essentially the plans that we kind of shopped around and were presented to are on the medical plan analysis spreadsheet, which shows, if you're looking at the columns, our current plan starting at the first column, the MVP, EPO, high deductible, Silver 8, and then the renewal, if we just renew the current plan. And what that does, if we don't like that plan because it increases deductibles under the renewal, more premiums, we would have to we would seek to contribute more to the HSA if we kept it. And employee contributions are higher too. So it's actually a substantial increase, almost 5% in premiums. And then we looked at different options. 1 through 4 is laid out, but essentially they're either HMOs or EPOs. And by kind of looking at the balance between the premiums, the deductibles, the company's costs, the employees' contributions, what the copay adjustments would be, and the trade-off for the HMO and the EPO, which really, I'm not an expert in this, but I'm learning from Gallagher. It has to do with the network availability of different practitioners in network, out of network, what that network's reach is and what is considered. We recommend, the best overall value appears to be, and from our analysis, option 2, which is the CDPHP, high deductible healthcare HMO, qualified 324 Silver. So that's option 2 in the new options column, if you're following along, committee members, on the spreadsheet.
Yes.
So with that, we see almost an 11% reduction in premiums, and there is an increase in copays to employees, but there's still an HSA contribution to help offset that, although we're proposing to only offer the HSA contribution to employees that opt into the healthcare plan that the company provides. And we would continue the vision plan. However, this is where we have kind of 2 options. We would use the vision plan that I circulated on the spreadsheet. I forgot the name of the company offhand, but it's offered through this package. Where is it? Vision plan. Here it is. Vision
Guardian?
benefits.
Oh,
this is Guardian, yeah. So Guardian, the vision plan is VSP Vision. So the thing here is we would need at least 2 employees to opt into the vision plan to be able to use this particular vision plan. And we don't know right now who will decide to do that. The window's rolling around. But in the event we didn't get 2 employees that want to use the vision plan, we would seek to reduce the vision plan contribution in the HSA from $1,000 per year per employee that is covered with an HSA to either $250 for a single or $500 for a family. But
so
we don't know. Yeah.
Adam, currently, what what do we contribute to the HSA for that health insurance plan?
Um,
Or is it a total of $1,000 for the health insurance and the vision?
No, if you look at the line just above,
Unfortunately, I'm not in the office right now, so I can't open the spreadsheet. I'm out on the road.
So it's 18. So it's about 1850. So it's two separate contributions. Its individual HSA contribution is about 1850, and family would be 3,700 a year.
half of the deductible.
And then which is half of the deductible for the high deductible health care plan, which is 30. Our current plan is 3,700 or 7,400, whether you're single or family, before you reach your deductible. And the vision was adopted at another 1,000 for the vision benefit, and we're seeking to change those down. So under the proposal, the HSA contribution to offset the deductible, because it's lower, it's 2,200 and 4,400 deductible under the proposed plan, would be a company contribution of 1,100 or 2,200 with respect to being individual or family. And the vision plan would go, if we don't get two employees to go into the vision plan, we would look to reduce the HSA, the company contribution, to 250 single or 500 family. And the Delta Dental we would just keep in place because that served us well. We haven't received any, it's been fine. And we didn't see a better rate presented to us.
And under
Was there an increase there, or is that the same rate for dental?
Same rate. The rate stayed the same.
That stays the same this year, yeah.
Good. Okay.
And we don't contribute anything to an HSA for that?
No.
For dental? No.
No, but it is HSA eligible from the other contributions. And under the current healthcare plan, pediatric dental is covered under insurance, the health insurance program, not Delta Dental.
Okay, under the MVP plan, what is the deductible?
Under the MV, yep. Under the qualified 324 silver, under the one we have right now, Jeff, or the one we're proposing?
No, under the new MVP, or whatever.
The new one. The new one we want to do CDPHP qualified silver. The new deductible would be 2,200 and 4,400. So it's lower, but there's more they offset that with the co-pays and the deductibles across the board on, urgent care and,
Right. So these deductibles pretty much apply to hospitalizations, or you just have a co-pay with the CDPHP, correct?
Yeah, you would have a co-pay.
You would have a co-pay, but the deductible, if you have preventative care, generally you just pay a deductible. But if it's anything beyond preventative care, then your copay is going to apply.
Okay. So again, the big deductibles basically are hospitalization deductibles.
Yes. So anything out of non-regular maintenance care.
Yeah.
Okay.
But you're still paying a deductible on top of your copay. So if you ended up in a hospitalization situation, you would still be paying your deductibles, and you also pay your up to the 2,200 if you're single and 4,400 if you're family.
Right. Yeah, that's pretty much standard. That deductible. Everybody pretty much has a deductible now. So.
Yeah. Yeah.
I think one of the important things here is that, the coverage appears to be very similar. Naturally, when you get down to the emergency room and urgent care, there is a cost attached after the deductible is met. However, the coverage that the employees are going to get, I think, is very good. However, the bigger piece here I see is the decrease of almost $5,000 that we're going to be paying, even though we have a part to play in it. Am I right, Adam? $44,785 is going to be less than the current.
Yeah,
amount that we're paying.
the way we're presenting it, Pastor Trainum, is we try to maintain that similar level of coverage, but we will pay lower premiums, almost 11% down from where we are, or where we would be, and then also reduce the HSA contribution in accordance with that, but also reduce the HSA contribution for vision. So yeah, there's a savings to the company across the board. But again, we tried to get it to the point where, without really hacking away, frankly, at the benefits packages that we can provide, because it is, part of what we provide to our staff.
I'm not a big fan of the vision contribution to the HSA,
Okay.
and $1,000 $500 is very rich.
Okay.
At some point, my fear with this, and I have to think about it a little bit more, but my fear with this is this is going to be kind of an annual event, and there's never going to be a way that as an organization we can offset all of these costs. And I think it's fantastic that we're seeing a similar plan with a reduction in cost, but we don't know what's going to happen next year, especially after, what's going on with the economy right now. But,
right.
I'm very appreciative that you guys, did what you did to get this cost down. I think that's fantastic. But I think I would focus on the HSA contributions, because there's no way. What do the employees contribute right now?
That is a voluntary contribution. It's not a match, so it depends on the employee if they contribute anything. Okay,
what is the contribution just for health coverage, like for an individual who wants to participate in the health in the insurance program, the health insurance program?
The individual person is covered, and then any additionals, the employee pays basically half of the difference between the individual premium and whatever premium they're on. So if they're on a employee spouse, they pay half the difference between the employee and employee spouse. If they're employee family, they pay half the difference between employee and employee family.
I can tell you right now, guys, that's unheard of. For the individuals to be covered at no charge, it's unheard of. Because
so what would put us more in line with? Well, that's one of the things that we want to make sure that now that we have the opportunity to adjust here, what would be more kind of in the standard realm, or is that something we should go back to Gallagher with?
Yeah, I think it's something, and again, other committee members, this is just, I come from an HR background, so I guess I have a different opinion. So I don't want to be heavy-handed in this, but I think it might be something that requires just a little bit more discussion. And maybe leaving it the way it is, maybe the way to go this year with the announcement that this will be the, kind of the last year that will be happening.
Okay.
I'm open to suggestions. I just know I can't think of an employer that I know, and I still do, some work in the field. I don't know of anybody, who's fully covered. This is a pretty rich plan.
So Jeff, actually, I have a comparison for you because I was allowed to take the HSA contribution and move on to my husband's insurance and save the company that money. I have done that, and on his plan, there's a very small amount that the employee contributes for the family plan, and it's nowhere near a single deductible. Wow, that's I can tell you we're covered in. I know that the call is being recorded, so I'm covered under my wife's plan, who has an extremely rich plan, and we contribute. Yeah, we contribute a small amount, but it's a very small amount comparatively to a premium. I'm open to suggestion. I'm not saying that my way is the right way to go. I'm just concerned with it going forward, because at some point it's going to become cost prohibitive.
Yeah. So I understand. So what if we, and one of the things that we talked about with Gallagher, Jeff, is thinking about the out years, and this was pre COV ID-19, like this couple of weeks before this escalated to the point where it is eventually working our way towards, even something more like the option 4 on the sheet, which, puts more of the share on the employee side and takes some of the burden off the company side, and using this as kind of the interim step to get there. So what if we, and I also don't want to get away from the vision comment either, because that's another thing we can look at. If, maybe maintaining option 2 with the HSA contribution for the healthcare plan for the company, but looking at our vision contribution, if any, to the HSA may be an area to make up for the savings. Because, I think if you had to choose, employees would prefer the healthcare over the vision, given just, what we've seen utilized in the past. So maybe that'd be a good way to bridge it. And then the expectation we would set for this year is this year does not represent what to see next year, and we're going to keep revisiting this annually, especially in the face of the crisis going on now, the economic and healthcare crisis.
Yep, absolutely. And again, I'm open to anyone else's suggestion here. I'm certainly not trying to mandate what we need to do. I'm just putting some thoughts out there.
Yeah. One of the things that I'm always looking at and looking towards is Jeff's input. And he makes some very valid points. But I also, dealing with people all the time, I know that most, if not all, households are strained. And I'm hoping that there could be a balance, whereas the employees are not going to be paying as much coming out of their pockets. And again, it's just me. Maybe it's just my calling as a pastor, always looking out for people, but we also have to look out for the organization. And this is where I looked at the $5,000 decrease that as an organization we're going to be presenting. But as Jeff is saying, should things continue to escalate, there may be a cost that we are not able to sustain in 2021, 22, 23, and continuing. However, I'd like to see as little come out of the pockets of our people as possible, especially right now with such uncertainty around our nation. And if we can do it for a year and, like Adam said, revisit it, I think that would be a good way to go. But again, this is just my 2 cents, my opinion, and again, fully accepting what Jeff is saying because he's right. But at the same time, trying to look at it from both perspectives. So my 2 cents, I'm not sure if Charles or if Todd is on the line, that they have something to contribute there as well.
So I think we can.
A suggestion that in the interest of time, could we go ahead and approve the change and make the staff, let the staff be aware that we're going to revisit this in 6 months? Because my concern is with the economic outlook right now, we don't know what's going to happen to sales. We don't know what's going to happen to funding for rehabs. We just
That's exactly right.
Know.
Yep.
And I would rather, if I were in a situation of the staff members, and I agree with the pastor, we definitely want to take care of the staff members. I'm more of a numbers guy. But I agree with the pastor's view on this. But I think if we say we'll review it in 6 months, because we just don't know in this economy, it's uncharted territory right now.
Yeah. Yep.
And I think most people will understand. Hopefully in 6 months, we'll be able to say we're going to maintain it for the next 6 months. And then, at the end of that 6 month period, we'll make deduction adjustments. If that's what we decide to do. But right now, I agree, whatever we can do to make it easiest for the employees, I have no problem with that at all. I'm just concerned that if in 6 months, we take a hit with the revenue because properties aren't moving. And right now, obviously, we can't even show any properties. So
just to be clear, though, Jeff, this is a 12-month contract, so we wouldn't be able to do any adjustment for a year.
Yeah, that's
what I was in with the carrier.
Right, but we could make adjustments to the staff.
Yeah.
We can
On the contribution side, yeah.
I don't know if can you do that can you
Sure.
create a 6-month open enrollment where you change it?
No, it's not an open. It wouldn't be an open enrollment.
Oh, okay.
You know,
So
but
you're
you can
saying
check with
it would
HR.
just be a increase in the amount that we would be requiring the employees to make? Am I right, Jeff?
That's correct. And if it can't be done, then we eat it for the year.
Yeah.
You know, if that ends up being something that can't be done, then you know we follow on for a year.
I think that's a good plan because we're headed into, we're in right now about waist deep, at least, uncharted territory in this economic situation. So, and then points well made about the economic realities for our revenue stream, especially in the business we're in, and that we're quasi-government, and who knows where government resources will be available. So, why don't I make a recommendation here to tie this all together based on all the feedback from the committee that follows like this, okay? So we will go forward. Well, we're going to bring this to the board on Friday. So we will present to the board on Friday, coming out of the committee meeting, recommendation to go with option 2, which is the high deductible HMO qualified 324 silver plan from CDPHP. We will, for now, keep the company HSA contributions for single and family as proposed on the sheet. So they're reduced from what they were, but they're still as presented. We will retain Delta Dental because the rates didn't change there. And we will offer employees the vision plan. And if we don't have a critical mass of employees, which in this case would be 2, opt into it, we will, for now, provide a reduced HSA vision contribution, but both of those HSA contributions and shares of who pays what will be clearly identified as something that will be revisited as we go forward every 2 quarters or every quarter into this new world of economic reality.
I think that's great because my thought, just so you all understand where I'm coming from, I would much rather everybody pay a little bit more than to have to eliminate a position or,
right,
cut staff. So, and hopefully it won't come to that. Hopefully, they're saying the economy may bounce back, quickly. But I think that's a safe plan.
Okay. Yeah, I think that's a good point, Jeff. Yeah, first we would look at benefits, especially with respect to the conversation we're saying. So I guess we should make a motion to move forward to the board. The recommendation I just set forth, if someone wants to do that, and then we could vote on it.
One last question about it. Is there another tier for the vision HSA contribution on the bottom of the page? Is there another tier for that because to offer VSP Vision or 250 single 500? Is there another tier that's less than that?
For the HSA contribution?
Correct.
Yeah, we could adjust that any way we want. The vision plan, I hope we have folks opt into it. The HSA contribution could be some, all, or none, really. We just sought to reduce it substantially for the purposes of getting towards that goal of reducing company share. But
right now,
it could
because it can be rolled into and be used as the overall health costs, say the regular health plan, do we need it at all?
So no, we don't need it. We could eliminate it to help reduce costs further. And
I don't want to eliminate it just to eliminate it because I'm mentioning it. This is just a cost, just a question, Adam and Jeff.
No, it's a good question, Pastor.
I'm just looking at it.
Technically,
so I think to add to that conversation, so the rates, if you have 2 people that participate, the rates, the monthly rates are on the sheet that was sent to you. So you could create a middle tier for the employee, spouse, employee, child enrollees if you want to do that. So there could be a middle tier there. I think the concern is if you're saying, we're going to offer this, but then 2 people don't enroll, we essentially can't offer it. So we would just have to talk to Gallagher about, you know, can we just disclose that and say if people don't enroll, then you don't get the benefit? Or what we were trying to do is just offer an option, an alternate option, should you have 1 person enrolled and you don't get 2 people.
Okay.
I think one
Jeff,
of the
were you
questions for Gallagher would be, are we better off just saying there's 1 HSA, you know, 1 contribution to the HSA and use it however you'd like,
Yeah.
Correct.
rather than splitting it up?
Okay. Okay. So
And
we
even,
can go
and
back to
even, and Adam, if I would, and Jeff, because I don't know if this is something that we could do, enrolling the vision into the single HSA contribution. How about going up $100 on instead of $1,100, $1,200, and instead of $2,200, $2,400, and eliminating the vision and putting, you know, and that way we're giving something. Or is that not the right thing to do?
No, that's
Again, I'm just talking off the top of my head.
I think it simplifies everything.
yeah. Okay.
It makes it simpler.
Yeah.
Because the truth is they can use that money for whatever they want anyway.
That's
Right. And if you want to use it for vision or you have a different HSA eligible priority, you can use it for that too. Okay. So I'm hearing the
Correct.
modification
and that
here.
way it's not being eliminated. That way it's not being eliminated. It's being rolled into something else, and we're not paying as much at the same time, but we are also contributing to the overall health of our people.
Okay. So then let me modify the recommendation here one more time, just for the record. So we would recommend moving to the board option 2 for healthcare, which is the CDPHP high deductible HMO qualified silver 324. The company's contribution would be $1,200 HSA for single, $2,300 for family. And those funds, $2,400 for family.
Yeah.
And then those funds could be used for any HSA eligible cost, which is, you know, the guidelines are clear, including vision. And we will not offer a vision plan, but we will retain the Delta Delta plan as proposed. Does that accurately recap that adjustment? I think so, right? Yeah. Okay.
That works.
All right. Any changes to that?
That works for me.
Okay. I guess, could we have someone willing to make a motion to advance it to the board as recommended?
I make a motion that we advance the topics discussed to the board.
Okay.
Second.
Second? Okay. All those in favor?
Aye.
Aye.
All right. Okay. That is all we have on the agenda. I guess with that, we could adjourn the committee meeting. First teleconference committee meeting.
Great.
Very good.
So maybe I think we should take a motion to adjourn.
Motion to adjourn.
And
Second.
Second. We're out.
All those in favor?
Aye.
All right.
Okay. Thank you all for calling in.
All right.
Be safe.
Thank you.
Take care.
We'll talk to you
Take
soon.
care. Thank you.
Bye-bye.
Bye-bye.